Good morning, everyone. This is Steve from MAG. This is our COC committee meeting, and welcome everyone. And I'll just bring it to our co-chairs, and we'll have a good meeting today. Thank you.
Hi. Good morning. Welcome, everybody. Welcome to the Continuum of Care committee meeting. We're going to call the meeting to order at 9:30. I think my clock is a little fast. My name is Michelle Jameson with US Vets, and I am the co-chair of the committee along with Stephanie Smith with Native American Connections. Can you hear me?
Yes, we could hear you.
Okay, all right, my computer, sorry about that. Prior to introductions, we will take a moment of silence for Mike McQuaid, who recently passed. Mike served on the Continuum in the past and was a respected colleague and friend to many of you. Mike dedicated his life to serving the community and towards ending homelessness. He will be greatly missed. Now let's have a moment of silence in Mike McQuaid's honor. Thank you. So we will start with introductions. I will call each committee member's name and ask you to introduce yourself and your organization. I'll start with my co-chair, Stephanie Smith.
Good morning, I'm Stephanie Smith from Native American Connections.
Thank you. So please introduce yourself when I call your name. Adrienne Clark.
Adrienne Clark, City of Surprise.
Morning, Adrienne. Stephanie Crum. Stephanie? Okay. Kathy Denolfi?
Kathy Denolfi, a new lead.
Thank you. Alfred Edwards? Okay. Dolores Ernst? Okay. Trisha Gibson?
Good morning, Trisha Gibson with ABC Housing.
Good morning, Trisha. Wendy Johnson?
Wendy Johnson, Justice Center.
I like your picture, Wendy. Anne Marie Johnston?
This is Anne Marie with Community Bridges.
Morning.
Morning.
Laura Magruder?
Laura Magruder, Maggie's Place. Good morning, everyone.
Good morning. Jennifer Page?
Jennifer's here from Mercy Care.
Aaron Rain?
Aaron Rain, City of Mesa.
Hi, Aaron. Nikki Ramirez?
Nikki Ramirez with Chicanos de la Calza.
Tama Riley? Excuse me. Tama? Ty Rosensteel?
Good morning, this is Ty Rosensteel, Director of HMIS at Crisis Response Network.
Hi, Ty. Shayla Schuster?
Shayla Schuster from Community Solutions.
And Sarah Sims?
This is Sarah Sims, Phoenix Elementary School District.
Laura Skotnicki?
Laura Skotnicki, Save the Family.
And Stephen Stivers?
Daniel Davis, proxy for Stephen Stivers.
I'm sorry, I didn't catch your name.
Daniel Davis.
Okay. All right, thank you. Welcome, Daniel. Joan Thornton?
Hey, good morning, everybody. Joan Thornton, Southeast Maryland.
Good morning. And Craig Tripkin. Okay. And just real quickly, I did not have Stephanie Crum.
Hello, I'm here. I'm sorry, my audio had cut out.
Okay, thank you. And Alfred Edwards, are you able to get on? Dolores Ernst. Tama Riley. And Craig Tripkin. Okay, thank you. So we'd also like to introduce the COC staff to introduce themselves. We'll start with Steve Dudasek.
Hi, good
Did I
morning.
say that right? I'm sorry.
Steve Dudasek, yeah. Hi, everyone. Good morning, Steve Dudasek from MAG.
Sarah?
Good morning, Sarah Kent is here with COC.
Julie?
Good morning, Julie Montoya here.
Good morning. Ann Scott's not on, is she? Her name's on here.
Oh, no.
I know. I hope she's enjoying herself. On a side note, we did get her a plaque, and I will show you a little on behalf of the COC. Full disclosure, it's still in my garage, and I do have to mail it out. So I'm going to put pressure on myself to get that out by the end of the week, but it is very nice. So we did do that on behalf of Anne. Unfortunately, due to my negligence, she hasn't received it yet. And then Tina Lopez.
Tina Lopez, good morning.
Good morning. So we'd also like to introduce our other presenters to introduce themselves. Bruce Leggett.
Good morning. It's Bruce Leggett, and I'm from Maricopa County Human Services Department.
Thank you for joining us this morning.
Absolutely.
And Hillary Evans.
Good morning, everyone. This is Hillary Evans from Crisis Response Network.
Hi, Hillary. Thank you for joining us. Okay, is there anyone else on the call that we'd like to introduce?
This is Craig Tripkin. I'm on the committee.
Oh, hi, Craig. Thank you. Welcome. Okay, so for all participants, please mute your phone on the computer when you're not speaking, and please do not put your phone on hold. We also ask that you identify yourself when speaking, and we will be reminding people to do that throughout the meeting, as we have been advised that this is important for the open meeting law. One final housekeeping item is all votes will be roll call votes, and Stephanie or I will call the roll after the motion is made. So now I will hand it over to Stephanie.
Thanks. Morning, everybody. Next, we'll move on to the call to the audience. Please note that members of the public were given an opportunity to submit written comments relating to this meeting at azmag.gov/comment within 1 hour of the posted start time for the meeting. Any written comments will be included in the meeting record. Steve, were there any comments posted?
No comments were received.
All right, I'll toss it back to Michelle.
So we will look at and need the approval of the June COC committee meeting minutes. So I am looking to review and then a motion to pass the committee meeting minutes, excuse me.
This is Ty Rosensteel. I move to approve the minutes from our last meeting.
Thank you. Do I have someone to second the motion?
This is Laura Scott-Nicky with Save the Family. I second.
Thank you, Laura. Okay, so we will proceed with a roll call. Adrian Clark.
Aye.
Stephanie Crum.
Aye.
Okay, Kathy Demope.
Aye.
Trisha Gibson.
Aye.
Wendy Johnson.
Aye.
Anne Marie Johnston.
Aye.
Laura Magruder.
Aye.
Jennifer Page.
Aye.
Aaron Reen.
Aye.
Nikki Ramirez.
Aye.
Ty Rosensteel.
Aye.
Chayla Schuster,
Aye.
Sarah Sims,
Aye.
Laura Skotnicki,
Aye.
Stephen Stivers,
Aye.
Joanne Thornton,
Aye.
and Craig Tripkin.
Aye.
Okay, the motion passes. Thank you. Okay, Stephanie, we're going to talk about the City of Phoenix strategies to address homelessness plan. So Meg's staff will facilitate a discussion for comment, feedback, and proposed City of Phoenix homelessness plan.
Yeah, hi, everyone. You were probably all aware of the City of Phoenix's plan. And we've been bringing this up in all of our forums and work groups. And I wanted to kind of facilitate or throw it out to the group, any type of feedback or questions. And not to put Ty on the spot, but there is a contract proposal between CRN and the City of Phoenix as well for a shelter availability portal. I just want to throw it out to the group. Any comments or feedback or anything you would like to state, having read the plan, which is very comprehensive and a lot of pages, like, I don't know, 40 pages or so. But I just want to throw it out to the group and maybe facilitate a discussion around this and provide feedback for the committee. So any comments or feedback regarding the City of Phoenix plan from anyone?
Yeah, this is Joanne. This is Salvation Army. I've been able to kind of improve the City of Phoenix's plan and the knowledge regarding the regional.
I'm sorry, we're hearing a lot of feedback. We're having trouble hearing you. I apologize for that.
That's okay. Well, I'll reserve the question for the comment box.
Yeah, that would be terrific if you could share some comments in the chat, and we'll be able to respond to that. So, thank you. Anyone else care to comment or talk about the City of Phoenix plan? Any questions for Ty's CRM proposed initiative?
This is Craig Tripkin. I've got a comment. I'm with Cass.
Okay, great, Craig. Yes, we can.
I've got a number of comments, but I'll focus on the most important one in my mind, which is of their 9 priority areas that they discuss. Primary work groups, I guess, is what they call it. But anyway, there's not a word of shelter in their 9 primary focus areas. I brought this up with the city, and they said, well, shelter is a part of the continuum of housing, which, given the different rules that apply and given the fact that, in my opinion, we're going to start seeing new shelter models emerging with more regional shelters and more issue-specific shelters, such as mental health centric shelter or a senior centric shelter. I think to not examine more closely what a shelter model or the future of shelter models ought to be is a real oversight in this. And it's not just another part of the continuum of housing the way the city is maintained. That's all I've got for now.
For now, yeah. Thank you for that. Any other comments or feedback regarding the plan?
This is Ty Rosensteel. I'd like to add one thing just real quick. Steve brought up the one particular item that is within the strategy of the City of Phoenix plan, and that is a contract with CRN to develop a shelter availability portal. The purpose behind this portal is to create a publicly available view of all of the shelters that are in Maricopa County, and to be able to list out what their names are, what their addresses are, what the intake process is, what the eligibility requirements are, what the capacity is, and really to be able to give an overview of what that availability actually looks like. And for all of us in this room, we know that that in itself is a very complex task, because to get shelter through some systems of care, there's a process by which you have to for families to access our largest emergency shelters, you go through the coordinated entry process, and then there's a service prioritization list. And to be able to describe that process and say there's actually not available shelter for families, there's not available shelter for people, and to be able to have that information updated on honestly a daily basis is the goal of this particular project. And the second component of the project is that the City of Phoenix has been highlighting that they have just multiple departments, multiple subcontractors that are constantly looking for shelter for people. And they're looking for a place for them to document those shelter interactions, or those needs for shelter. Yeah. So they're looking for a place that, the library can say, we are looking for shelter for a person, and we, as a city department, want to document all of the times that we are looking for shelter for people and what the results were when we searched for shelter. The piece that has come up as a controversy here is that one of the intended users of this are also first responders, including fire departments and police officers. And I think there are a number of people that have raised concerns about how exactly this tool would be used in an interaction between a person experiencing homelessness and police, particularly as it comes into the perspective of the Ninth Circuit Court of Appeals decision around any type of criminalization of homelessness and shelter availability. I think the piece that I just want to share here is that this is the goal of this project is to create a transparent tool and a place to be able to provide documentation. And in many ways, this would be able to sort of force the city and allow the city to comply with the Ninth Circuit Court of Appeals to be able to say they actually are looking for shelter. And it's one of the things that the city says over and over again, that they are looking to provide services first, and to offer services first before enforcement. This would provide an opportunity for them to actually document that. So the piece I want to share is that I'm very open to feedback here. We don't have a signed contract, and we are holding on the contract until these feedback sessions are complete. So if there are people of this committee that believe that this project should not move forward, please either say so now or call me and talk to me about this. I absolutely want to hear that feedback. And I genuinely believe that this is a needed tool, that this is something that we really need to be able to use to demonstrate the need for shelter and to be able to communicate with persons that are looking for shelter. But I also want to acknowledge that I am not the only person that should be making the decision on if this is a type of tool that is in use in our community. So I'll just pause there. I know that this is this comment or this agenda item is meant for like the overall view of the City of Phoenix plan, but I did just want to address that specific contract because it has been something that has come up as an item of concern for people within the community.
Thank you, Ty, for opening that up. Any comments or reaction to what Ty's saying regarding their proposed contract? And again, from MAG's perspective, we have been hearing feedback as the city has, as CRN has had regarding the use of this tool by the Phoenix PD. And any reaction to that or comment for this forum?
Hi, this is Stephanie.
Go ahead.
Oh, sorry. Hi, this is Stephanie with HSC. I know I've been in a lot of different meetings giving HSC standpoint, so I'm not going to reiterate all that. But I do have a question that I didn't really think about, Ty, until you were talking about it. So with the City of Phoenix police officers, if they're responding, to, say, a homeless encampment in Phoenix, are they going to be looking at shelter, like say in Surprise, Tempe, or are they only looking at Phoenix shelter?
The reason I say that is I'm just concerned that, say, if somebody's down here connected to services, Circle the City, CBI, or anything downtown, and then they're told, well, there's a shelter bed in Surprise, are they going to be forced to take the shelter bed in a different city or face a consequence? So that, I think that's my main concern.
So thank you so much for saying that, Stephanie. I'm not in a position to be able to speak on behalf of the city of Phoenix or to be able to speak on behalf of, you know, what a police officer does. What I can say is that, you know, I've had a number of conversations with city attorneys on the Ninth Circuit Court of Appeals decision, and they're really trying to find ways to comply with that decision. And one of the core elements of that is that a person is not required to accept shelter if it does not meet their needed specifications, right? So if a person has a particular barrier and or a particular service need, and that shelter does not offer that service need, the person is not required to take that shelter, that shelter option is not considered. So an easy example of that would be, oh, there's a bed available, but I'm banned from that shelter, right? Well, obviously that bed doesn't really exist for you then. Another example that they gave was religious preference, right? If there's religious service requirements at an organization and the person does not want to participate in the religious service requirements, that also would not be a required item. So I believe that conversation around service availability, saying I'm connected to services at this location and therefore it's appropriate for me to stay in relevant transportation. I do believe that that is within the guidance of what the Ninth Circuit Court of Appeals decision had outlined. So I'm personally not concerned about that, but that really is a question that we would want to have documented by City of Phoenix or particularly the police department. And I will have that noted and make sure that there is a written response to that particular question.
This is Craig
Awesome,
Tripkin.
thank you, Todd.
I'm sorry, this is Craig Tripkin. I've got a statement and a little bit of a question. And Ty, you can probably address this. This isn't going to work if everybody's got to go through coordinated entry before they get a bed. We can send people to coordinated entry and make sure that they go to coordinated entry within a day or two. But if they've got to go through coordinated entry with the limited hours that coordinated entry operates, we won't be able to, CAS will not be able to deal with this system successfully. And so I just want to emphasize that it should be a direct connection between whoever is the pickup point for a homeless person and the drop-off point. It really can't be coordinated entry, at least initially. We again can agree to, we will get people over to coordinated entry, and that's our deal with that's our deal. But anyway, that's enough said for me. But I just think coordinated entry can't be a necessary or a vital or piece of entry initially.
My comment there was really oriented towards families that are our largest family shelters. That is a requirement that families go through the coordinated entry process, and then shelter is prioritized based off of a family's need and their unique circumstances. There was a work group that was meeting earlier in the year to discuss shelter prioritization for singles, and this project really doesn't have any, direct policy implications around how coordinated entry is run. But I would say that a tool like this and the availability of the information that would come from a tool like this, I believe that would be invaluable to our coordinated entry sites, particularly on the single side, that if they did want to do coordinated shelter, this is the type of tool that would be needed to sort of power that conversation. So I believe it as sort of a necessary infrastructure item to be able to assist in that conversation. And I believe the data may be supportive of that conversation. The data that comes from this collection would be supportive of that conversation. But again, the portal itself is a sort of a neutral data transparent tool. It doesn't actually have kind of built-in policy implications. Does that make sense, Craig?
Yeah, thank you. That helps a lot. Thank you.
This is Wendy Johnson from Justice Center. I have two items related to this. like Craig said, one's more a statement. One is to Ty. I think the city of Phoenix did you a disservice and did us a disservice in the way they presented this contract, because it was a police portal was what they published. And that's what I think got me and everybody else concerned about that. I also have some real time issues with it. So if there's one shelter bed in Sunny Slope and they pick somebody up at, 35th Avenue in Glendale, by the time they get to Sunny Slope, somebody from Cave Creek has brought someone in and now we have no bed. And so, there's some real time, and then they've dumped somebody in a community where they haven't been before. And so there's just some how the police would use this is really a concern for me, because then it's, hey, there's no bed, so, why don't you stay with us? Let's have a sleepover at the jail. And so I don't want to see that happen. And I know we can't control that, but Ty, I feel like you've gotten some heat. You and I talked because of the way the city presented this, which none of us can control. The second thing I'm concerned about is I'm pretty new to this, back to the Valley. And when I go back and look at what the city of Phoenix has proposed for homelessness assistance, there's a huge amount of time that seems to be invested in the run-up and very little in good implementation. And so I'm wondering how we can weigh in on the implementation side of this, because I feel like the contracts office takes the path of least resistance and does what they've always done. And if we spend all this time helping the city and helping our clients navigate homelessness, and we've just polished the old paperwork back up again and nothing changes, that will be extremely frustrating, and it will further disenfranchise all of us from wanting to work within systems in a region. So I just, that's my only concern. Like I said, I'm new. If somebody else has better experience, then yay.
Thank you, Wendy. Any comments or discussion from what Wendy just said or what Ty has been offering?
This is Taylor Schuster from Community Solutions, and I want to go back to what Ty was talking about, and I will say that I have been a bit out of the loop on the conversation. I've been following the policies, but I haven't been involved in a lot of the community conversations around that. So if I'm seeing something that's already been discussed a lot, I apologize for that. But I guess I just have two sort of comments or concerns around it. And one is sort of like the coordination with the PD and outreach, and sort of maybe like that, as like we have more and more discussions nationally about who should be responding to emergencies, like how do we make sure that outreach isn't getting usurped and that people are actually having good coordination with outreach teams, especially if they are, I don't like the word service resistant, but if they are not ready to go into shelter, they don't want to go into shelter at this time or whatever, and that we're like still having really good conversations and supporting people that are on the streets and providing the services and support and meeting when they're at. And then the second thing that I really want to know is how can we as a COC, and I think like particularly I think board members might have some perspective on this, or MAG staff, how can we bring the City of Phoenix PD? I understand that Rob Ferraro from Tempe is on our board, but how can we get more relationship with the City of Phoenix PD on the COC? Like, how can we really nurture that? And has there been discussion around that? And what would that look like? Because I do think that building a stronger relationship and building a deeper collaboration may help a lot as well.
Yeah, I couldn't agree more, Chayla. Honestly, what I can say is that on the CRN side, we've really been advocating to be having a stronger relationship on a crisis response network side. Those that are familiar with kind of behavioral health and mental health and substance abuse related issues as it pertains to police, crisis response actually has a really good relationship with police in this regard, that if a person is experiencing truly a behavioral health or mental health crisis, they are dispatching a mobile team, and that is adequately funded through Access. And, there's an entire process and system, and, we're getting 40,000 calls a month through the crisis response system call center. And, one of the pieces that we're advocating just on a CRN side, and this is totally separate from the shelter portal stuff, right? Just on the CRN side that, if a person is experiencing homelessness, let's have them talk to someone at 211, or let's have them talk to an outreach team, and that the police not be the first response. So I'm completely in line with that as a philosophy. And I think that that is a great general comment about, the city of Phoenix and their interactions with homeless persons. And I absolutely agree. The idea of not only fostering relationships with the city of Phoenix on an agency level and personal level, but as a community and as a continuum of care. I absolutely am in complete agreement with that.
And to your comment, Tilla, about board involvement and what we're doing from the COC side, engaging with the Phoenix PD. As it stands right now, we do have board representation from the city of Phoenix right now as it stands. So we, moving forward, we'll certainly have those discussions, I feel. Again, I'm new on board here, but it's something that we'll look into. And, your comment is very much noted and understood. And, we could generate that conversation moving forward.
Hi, this is Hillary. Oh,
go ahead.
Somebody. Hi. I was just thinking, Steve and those of us that have been on some other calls while we discussed this, we've discussed this at length in our race equity group. And Samantha Jackson, who's with the city, has said that she would love to engage with Phoenix PD and the relationship she has with Phoenix PD to help us kind of navigate some of these things. So that has been a discussion item that we've gone over a few times and have plans to continue to engage with her and her relationships and utilizing those to talk about this.
Yeah, and I just want to make note for further comment to the city of Phoenix. Hillary was so nice to post the website you could go to post your comments, and I think sign up for the Zoom calls that they do have regarding this. Any other feedback? I know we're cognizant of time, and give let Bruce give a county update. So any other comment right now regarding the City of Phoenix plan? I will say from our perspective, we'll continue to have these discussions. My understanding is that it's going to go to council in October for final approval. So hopefully we'll continue to have these discussions amongst all our friends in the COC and these type of forums, and move forward regarding the conversation. So any other feedback?
Yeah, Jawan, Salvation Army, thanks for taking the time. One quick thought, doesn't really match up well with the Maricopa Regional Continuum of Care plan to end homelessness, is what I was saying earlier before I got broken up. The second piece, to echo what Chayla has already mentioned, if you get PD involved and you're working through PD to put, or not the police, sorry, wrong usage, but when looking at the families or individuals who experience homelessness the most, you got to be practical in the approach, because much like Chayla and Hillary mentioned, you don't want to go at this in the manner in which you just are funneling families or individuals into these shelter units, and PD is responsible primarily for that. You got to have an integrated approach. So if to, kind of piggyback off of what Chayla mentioned, we may need to look at strategies in which we can enlist experts in the field, outreach teams, individuals that know how to make these connections with individuals and families, so that this plan can actually, or at least this portal for police and emergency shelter units can be viable long-term. At this juncture, and reading this 47, 50+ page plan, there are some positive points in which I was able to gather, but that's one piece that really sticks out, which leaves a couple question marks on top of my mind.
Thank you for that, Jawan, for that feedback. The other thing I just want to mention, I know, the AZ Housing Coalition has received feedback regarding this plan as well. If you'd like to reach out to the folks there, you could do that. And of course, the City of Phoenix is taking comments. And, you know, Ty, I appreciate your transparency on this and willingness to have this conversation flow and your willingness to take feedback. So I think because of time, why don't we table this conversation right now? No, we're going to continue to have it through all of our forums and, you know, even reach out to us individually, and we'll continue to have this conversation. So that said, I'll throw it back to, I guess, Stephanie, is it, to introduce our next topic. Thank you, everyone.
This is not on the agenda for action, so we'll move on to the next agenda item, which is an update from the county. So Bruce, Legit, I apologize, Bruce, if I said your name wrong, Legit from the county will provide an update on responses to the COVID-19 pandemic.
Thanks, Michelle. Is my audio coming through okay? Good. So yeah, I'll just do some kind of quick updates. I think I've presented at the last committee meeting. And again, thanks for the opportunity. And as I say, always, what I'm talking about is really the work of everybody in the county and all the partners that we have with the cities and the nonprofits doing this work. And many of you on the committee and on this call know more of the details than I do about some of these projects. So let me first update folks in terms of our alternate care sites. The county has contracted now with 4 different hotels. 3 are for vulnerable individuals, and the capacity there is 121, and those are full. We also have another hotel, which makes it 4 total in direct contracts with the county. That is for people who are positive with the COVID virus or under investigation. And we've got a capacity there of up to 136. Presently, we have between 30 and 50 people there on any given day. So we've got some expanded capacity if numbers start to increase there. So those are the 4 hotels that we have directly with the county. Then we have 3 hotel partnerships with Mesa, Chandler, and Tempe. And in those, the cities find the hotel, we reimburse them for the cost of the hotel and the security, and they continue to provide the case management. So this is a little bit more of a regional focus where each city is finding in their community a hotel, and the capacity there is between all 3 of the hotels is 32, and those are also full. So our overall bed capacity in alternative care facilities with what the county is doing is 289. Occupied, the range is generally from 170 to 190. So that's kind of the total overall look. You should know that we're going to try to do our best to people who are placed in alternate care settings to make permanent housing placements for them, whether it's permanent supportive or rapid rehousing. And so the federal money that we got that's COVID related, that does not expire in December, is the money that we're going to be using. So we already have contracts either in place or being finalized now with 5 agencies to provide 131 placements of the vulnerable people into housing. And we have some additional money that's not yet been allocated that we will also use towards this effort. So we're going to do the right thing by as many people as we can in terms of their permanent solution. So that's alternate care facilities. And just to explain a little bit about heat relief and what's going on. And our activities have mainly been centered around heat relief in downtown Phoenix and the Human Service Campus. So the Lodestar Day Resource Center, the campus is made available for 47 evening spots. St. Vincent de Paul is available for 80 spots. And then we opened the county building a few weeks ago, right downtown Phoenix for 130 people. So we have a total of 257 people spots that we could use for heat relief. And the past week, they've been filling up more. The one that we started with the county building kind of slow to take on. We're doing it in coordination with Phoenix, who's doing a great job of providing transportation to their daytime convention center heat relief that can hold up to 200 people. Then over to ours in downtown Phoenix for 130 people. So in total number of heat relief night beds, there's 257, which is comparable to what we had as an average number that we did last year pre-COVID. So that's heat relief, and beds were available last night for heat relief that were not being utilized in the downtown county location that the Human Service Campus runs for us. Just a brief mention of testing. The County Public Health Department has entered into 5 agreements with testing agencies. And so we've begun, as capacity allows us, to expand some of those to congregate sites outside of the Human Service Campus. So I know we did something at St. Vincent de Paul Dining Room. We've worked with Native American Connections, East Valley Men's Center. And so testing is more widely available, but certainly it's not universal testing. And then the final thing that's related to homeless prevention is the county's rental assistance program. And so we have funding to be able to provide for 18,000 months of rental assistance. What we're giving people is up to 3 months. So that could be 6,000 households that receive those. We're paying $1,500 per month for each of those. And income eligibility limit is set at the area median income. So half of all households that are renting should likely be qualified for that. And I'll put it in the chat section, but people can go to Maricopa.gov, COVID rent help, to apply for assistance. And there's a pre-screening that's done with 9 simple questions that'll let you know if it looks like you might be eligible. And then people can attach their documents and those cases will be processed. So it's kind of the full range of the kind of things we're working on in our area. I'd be happy to take any questions if there are any.
All right, so I'm going to assume there are no questions.
I just have one. I'm sorry, Bruce.
Okay, go
Hi,
ahead.
this is Steve from MAG. I'm just wondering with the testing, have you had any challenges with the turnaround from the labs? You know, we read nationally it could be 7 up to sometimes 21 days to get a result back. Have you experienced any of that with the labs that you're utilizing?
We were experiencing the delays, but those have really shortened significantly now. And we're getting, especially for some of the campus related, the Circle the City is involved in 2 to 3 day turnarounds, which is a really good turnaround. And so glad you asked that. That's important, but it's getting much, much better for sure.
That's good news. Thank you, Bruce.
And you know, the county public health tracks all positive COVID cases. And the medical personnel who fill out that form, or if there's a positive case and somebody from the county contacts people on the form, they can check if they're homeless. It's certainly not the kind of definition that we would use for homeless. It's self-reported one, which is the only way it could be done right now. But it reflects people who may not have a permanent place to live, but may be living with family members and those kinds of things. But in terms of that total number of people who self-reported as homeless, we've had about 490 cases. But when we look at, and that's just positives, so we don't have the number that have tested and were negatives because the county's tracking the positives. But with some of our relationships with providers who do testing of homeless, I've got no data or evidence to suggest that the homeless population has been disproportionately impacted by COVID than the general population. The percent of positives seems to be consistent with the general population, which is really, I think, counterintuitive in terms of how vulnerable these people are, the inability to social distance. So I think at this point, knock on wood, and things could change. So this isn't a headline yet, but I think we can all feel pretty comforted that the work we're doing is making a difference for the people that we work with.
Thank you. I appreciate it, Bruce.
Anytime.
Bruce, can I ask a quick question? For the alternate shelter sites, are they full, or are you, I'm curious just how much you guys are having to utilize them?
All the alternate care sites for the vulnerable are full. and that's the population that we're targeting and trying to get into permanent housing placements now. But the expanded capacity we have is at the hotel that we've got for people who are positive or under investigation.
All right, thank you. Any other questions? All right, so this is not on the agenda for action, so we will move on to the next agenda item. Stephanie?
Right, next we will have Hillary Evans from CRN will present on the HMIS COVID assessment data.
Thank you, Stephanie. Hi, everyone. So I'm going to share my screen here really quick. Let's see, sorry. There we go. I'm going to start a little bit from the beginning in case folks don't know. But in HMIS, right when COVID started, and we realized it was going to have an impact on the homeless system, a screening tool was created to ask questions about symptoms and track whether someone was potentially positive. And the goal of that was to empower agencies to make decisions about where they were going to place folks or how to coordinate services between other agencies. And so that started in, I think, late March. And then in addition to that, we created a second tool that was requested by the Continuum, and that's a vulnerability screening. So looking at using CDC guidelines, using those guidelines to create a screening tool that would then, I guess, kind of create a number in terms of vulnerability of individuals that again would allow folks to isolate those vulnerable individuals from congregate settings or whatnot. So we have two tools that are in HMIS. The tool I'm going to talk about today is the screening for COVID tool, which has been utilized the most and gives us some interesting data. One thing that we know and that we've shared with MAG is that there is a discrepancy in terms of how many folks are being screened and how many folks are coming back with a positive diagnosis versus what perhaps the county is seeing in terms of homeless individuals. So we really look at this not as something we would distribute outside of our continuum, but as a way of seeing some of the trends that we're seeing just with the small population that we have that are positive, and then also really using the tools that are in HMIS as a way to coordinate services. So I'm going to show a little bit about that. As you can see that we've had 525 people screened using this tool, and this is the COVID positive tool, and 193 have reported a positive test to COVID-19. And then I broke up that population of folks that are positive just to give us an idea of some of the race and ethnicity of those folks, as well as veteran, chronically homeless, and number of positive with mental illness. And I think there's some trends that stick out that are important for us to note. High population or a high proportion of the folks that are positive have mental illness. We're seeing that our American Indian and Alaska Native population is being highly impacted in the homeless population with this virus, which is consistent with what we're seeing nationally. And I think as we think of resources and how to support our continuum, that we want to prioritize, of course, people of color and what they're experiencing, and particularly our American Indian and Alaska Native community. I have some comparison here with our PIC count, seeing that 7% of the population that we serve in the homeless community is Alaska Native. Sorry, I haven't had my coffee yet. American Indian or Alaska Native, and then you compare that with 17% positive for COVID. So it's a big discrepancy and concerning. There was a document that had sent out this last week about why they really want to see us doing this and collecting COVID data, and why they see it as helpful. A lot of it is about being able to tell our story as a community about how COVID has impacted our homeless system. and advocating for resources, but also for being able to coordinate between stakeholders, including public health, which is something we're doing in Maricopa. If you're not aware, we're using this COVID data to coordinate with healthcare providers to ensure that anyone that's showing up on this screening is connected to their healthcare provider, and their healthcare provider is following up with them to ensure that they're getting the services that they're entitled to and need. So within the reports, and I'm going to show you in a second where you can access these reports. If you're a provider in HIS, you have access to run COVID reports and do your own analysis and look at your own data and make comparisons, and we encourage you to do so. This is a list that comes up on the one of the reports. It shows that everyone that has participated. I think it's, CBI, good job, yeah, especially at the emergency shelter, getting, that's a pretty high number of screenings that you did, and these all happened within the last couple of weeks, so that's really notable. But you can see that we're getting a lot of different agencies participating, and the more we have participating, the better coordination we can do and the better information we can have as we continue to tell the story of impact. Another, I think, important tool is that what's included is the most recent provider of the person that is positive, so that if they are new to your shelter or new to your program, you are able to see that they were positive recently or whatnot, and where they were. So again, about coordinating services. Any questions about this tool or what I just showed you before I go to the next one?
Hi, this is Michelle. I have a question. I must have missed this because we would participate, but we're not on this. And so how do we, or I don't know if we're on it or not, US Vets?
These are all the providers that have entered it. So let's see. Nope.
Oh, we did. Or SSVF, but our other ones.
Oh, okay.
So where do we go to
do this? Yeah. Let me, I'm going to send, Steve, what's the best way to do this? Can I send you a video about how to do this screening that you could shoot out to the group?
Yeah, that sounds like a good idea, Hillary. Yeah.
Yeah. And Ty, this is already set up for every agency in Maricopa, correct?
Yeah, so I'll actually type it into our link right here. So this is, wrong link. That is Bruce's link. Sorry about that. That's a good link too, though. Rental assistance. Shameless plug for Maricopa County Rent. If you go to hmisaz.org/COVID-19 data collection, that link will show you the assessment guide and data entry FAQs for this. And then if you just want to reach out to the HMIS team, either through our website or through our email address, we'd be happy to walk you through the screening tool.
Okay, thank you.
Yeah, and we do have a video too. We in one of our recent agency admin webinars, we went over how to input the data, if that's helpful to have a visual of it. But yeah, if anyone wants, we would love your participation. It's super helpful. The more accurate our data is, the better we can coordinate services. So I ran this report just as an example of what information is available to you. This is an agency specific report. So I ran it for CBI, but you can see that other entries came up. And Ty, can you explain this? You're better at explaining why these other entries came up than I am.
Can you say that one more time, Hillary?
Yeah, sorry. So I ran, this is a project-based report. I ran it for CBI, but other agencies come up as participating.
Yeah, absolutely. So the cool part about this is because we are collecting this data in HMIS, it does allow for an agency to see the other agencies that are interacting with your clients. So although this particular report that Hillary is showing is run on CBI and clients that were served by CBI, there was data collected on these persons' experience with COVID-19 by other agencies. So these other agencies that are listed are effectively agencies that interacted with CBI clients in the past since the beginning of COVID-19 data collection. So there is a lot of crossover between agencies and this particular report and agency that Hillary ran the report on. So the part there is that like this is an opportunity for continued coordination, right? If you see that many of your clients are connecting with a particular agency, that certainly would be a point of conversation that may need to happen between your agency and that other agency.
Thank you. And just so you know, when you run this report, you'll see all the client data. I took client data out since I'm sharing, but you would be able to see the client ID and be able to track that way. So just a really quick showing you what's in here. This is a summary of all the information. So it would be when they were most recently symptomatic, when they most recently had a test, what the most recent diagnosis was or when it was, and then if they recovered and that was put into HMIS, that'll be there. And then if they ever had a positive viral test, so, again, this is just for CVI and doesn't have all of the information, but it would have any of the positive folks that are that have been touched by CVI or otherwise. And then if you want to like really get into that, you have all these options. So symptomatic, tested, where were they tested? What was the result of the test? If they recovered, information about that, who provided that information, what healthcare provider provided the information that they recovered. And then as Ty was sharing, where they were in the last 90 days. And then their most recent provider. And then we also have outreach information. So if outreach engaged with this person at all, that information is in here, and then where they last engaged with them. So this can be a really useful tool on an agency level, but then also they can look at it, take a step back and look at it from a systems level. So I'm just going to show you. I have so many different things open. Oh, did I close it? I did. Well, I was going to show you where these reports were in Service Point, but we did make a file that's COVID-19 only reports, and so you're able to. And I'll post something in the chat box about that. But where you're able to see all the different reports available to you in one place, which is important. Are there any other questions about that or about this before I close it out?
No questions for Hillary? All right. Hillary, I do want to say thank you for pointing out the disproportionate number of Native Americans and Alaska Natives who are being affected by COVID.
Yeah.
This is not on the agenda for action, so we will move on to the next agenda item.
Can I say one more thing, Stephanie?
Yeah, of course.
Is my screen still showing?
It is.
Okay. So you can see here the COVID-19 reports.
And actually, Hillary, we see
wrong one.
We see an Excel file still.
Oh, okay. Thank you for telling me that. Oh, I wonder if I should. That's not helpful. Okay, here we go. Now you see this? COVID, you see HMIS?
Yeah.
Okay, so within the public folder, common agency reports, we have this COVID-19 reports. And the one that I ran and showed you all was by provider, right? I did it by, I picked a handful of CBI's programs that of their newer programs, and I ran that report. But you also have the option of a system-wide one, and so information that has been shared and you can see would be in here. Anything you want to say about this, Ty?
Nope, we covered these reports during the last agency admin webinar training. So if you didn't attend that training to view these reports, someone at your agency very well may have. And so connecting with your primary point of contact at your agency for HMIS, they'll have access to that training webinar, and they're also posted on our website.
And I'm sorry, I didn't say this right. So there's the high risk screening, and then there's the COVID-19 system test and recovery. So remember, this is the one that allows you to decide within your agency, okay, these are folks that we need to separate or isolate because they're vulnerable for COVID-19 versus these are folks that have been tested, have been symptomatic, have recovered. So there you go.
So this was not on the agenda for discussion, so we will move on to the next agenda item, which is the NOFA scorecard. And we will ask Julie Montoya from MAG to present. Julie, thank you.
Yes, thank you. Can everybody see my screen? Yes, okay. Thank you. So the board at the July meeting did approve this scorecard. And I know there was some discussion at the last CSE committee meeting about some concerns. And so MAG staff and board members did put together a work group between the last couple board meetings and went over and reviewed the scorecard that had been presented at the last meeting. And specifically, we had looked at 3 of the criteria for scoring, the 1B, no income at entry, the 2A and 2B, increasing housing stability, and then 3A, increasing total income. And so ultimately what was decided, we went ahead and eliminated 1B altogether from the scorecard. You can see it's gone here. Basically, you know, with further discussion with board members and MAG staff, we decided that it didn't carry as much weight as it had in previous scorecards. We now have 6A and 6B, which are more geared towards scoring around coordinated entry, acceptance, and decline rates. And so we kind of agreed that that really wasn't needed as much anymore moving forward. So we went ahead and eliminated that completely. 2A and 2B on increasing housing stability. Basically, the points and percentages, the ranges were adjusted here. Also, in the previous proposed scorecard, the points were dropped down by 2s all the way from the top all the way to the bottom. And so we changed the top half of the points to just drop down by 1, as you can see here, until you get to the bottom. And then the top range of percentages here was also brought down somewhat for both PSH and rapid rehousing. So for PSH, previously it was to gain 15 points, it was 98% or more, and we dropped it down to 95%, which was a little closer to the averages you see here with system performance for community-wide percentages. So we decided to bring down those ranges a little bit more. And then on the rapid rehousing for that same criteria, we did the same thing. Previously it was 85% or more to gain 15 points, and now it's 80% or more, again, to align more with the average system performance percentages. So also, in addition to those changes for 2A and 2B, we also added language, which is right here where my cursor is. We added language to also exclude persons exiting into foster care homes or foster care group homes, hospital or other residential non-psychiatric medical facility, or long-term care facility or nursing home, to exclude those from negative calculations. So previously it just said we were excluding participants who had passed away from the calculation, and so now HUD has made these particular destination areas not negative destination. So we decided to be more in line with the HUD, the way HUD has aligned that in HMIS. So programs will not be penalized for those destination exits. And then 3A, increasing total income for permanent supportive housing.
We kind of did the same thing as we did in 2A and 2B. We adjusted the scoring ranges and percentages to reflect more of what we've seen in the past scoring. So for the top points here for 5 points, previously it was 60% or more, and now it's 55% or more. So the calculations were just kind of readjusted here. Did somebody have a question? Okay. And then lastly, we added a little bit of language here on the bottom to say gaining a source of income by increasing or maintaining non-zero income. So the maintaining non-zero income was the language that was added. Some of the feedback we had received from other meetings was that it was hard for persons who had a fixed income, specifically Social Security income, to increase income. And so that we felt that maintaining the income, especially for those with a fixed income, you know, we didn't want that to be penalized because not seeing a whole lot of increasing of income for those folks. So that language was added to the scorecard. So those were the changes that were made to the scorecard. And like I mentioned, it was already approved. We have not heard from HUD yet whether there will be a 2020 NOFA competition. But as we had stated previously, we wanted to be able to be a little proactive, have this scorecard finalized and ready to go in case any day HUD comes out and announces that we're having a competition, and we'd be ready to go. So does anybody have any questions?
Okay, any other, going once, twice? Okay, no questions. So this is not on the agenda for action, so we will move on to the next agenda items. Stephanie? Yeah.
All right. Well, Julie's on again to update committee on the racial equity work with Jeff Olivet Consulting.
Yes, thank you, Stephanie. So we are continuing our work with Jeff and Donald. We're currently in the review and assessment stage. Previously, we had held several stakeholder meetings and focus groups with persons with lived experience. Also, a survey went out to the community for feedback in regards to our services and in our homeless system. So right now we should be receiving some feedback from Jeff and Donald next week on the results of all the information that was given to us. Also, the HMIS team provided quite a bit of data to Jeff and Donald as well that they will be also informing us about. Moving forward, we're going to move into the planning stage. We're going to be holding 3 strategy sessions, one next week and 2 the following week. So invitations will be going out into the community. We want this to be a community-wide planning stage, not just a MAG or a small provider group planning stage. We want this to be, as regional as possible. And then looking to be able to actually create some actionable steps to provide some opportunities to not have disparities in our system, which we know there are with just the data that we had previously to our work with our consultants. So we are looking at also a second phase of our consultant work with Jeff and Donald to be able to look at some other things moving forward, because there's a lot of work to be done, and we don't want this to just end and be done and just say we looked at it and that's it. We want there to actually be work that is done over our continuum. So I think that's pretty much it. Is there any questions or comments?
I have a question, Julie. Do you know yet of the surveys that went out? Do you have an idea of how many were completed yet?
You had to ask me that. I was trying to remember what that number was.
Sorry.
I'm looking here at my notes. No, that's okay.
I think it was like 275, Julie. It was close to 300.
Yeah, I want to say it was close to 300. I'm like scouring my notes here because I wrote it down somewhere, but that sounds about right. Thank you, Hillary.
Yeah, hi, this is Steve from MAG. I just want to say, yeah, there's been a lot of community interest with this project, and we're really excited about it. And, you know, everyone in this group, in this meeting today has been integral to getting this off the ground. And, you know, to Julie's point, we are excited about the opportunity to work with Jeff and Donald moving forward. So it's not just about putting the plan together. It's really trying to develop system-wide actionable steps. So, you know, racial equity occurs within the region and our system. So we're really excited to continue this work with everyone.
Anything else for Julie? All right, hearing none. This is also not on the agenda for action, so we'll move on to the next agenda item, which is an update about the work between PSH and long-term care. I'm supposed to have an update, but my update is there is no update. We've totally hit a wall getting through to any other systems. So if anybody else has connections that we haven't tapped into, we're open ears.
Stephanie, this is Michelle. So has the group met, and what are the roadblocks, or will there be an upcoming meeting with a work group?
We haven't met for a minute. So we drafted a letter, and Mike Traylor, who's now with NEC, he got that over to David Bridge at Access, who I guess we had some initial interest in that, and he said he, you know, had somebody who might be able to work on that, and tried to follow up and haven't gotten. I'm not calling anybody out by any means, just letting you guys know what happened. But we haven't gotten a response, and I've tried to follow up through Mike Traylor as well into that system, and just not getting a response. And then I also tried to outreach somebody else who works at the state who I thought might be able to help navigate that, and I haven't gotten a response from her either. So I don't know. Like who else to go to, like what other avenues we can explore with this. But we haven't met because, I mean, in the beginning, we all kind of put our heads together, like, you know, I think this would work, let's do this. We did it, and we hit a roadblock.
Stephanie, this is Nikki Ramirez with CPLC. I don't know if I missed it, or maybe it was, you know, started prior to me joining the committee, but could you give me just a little bit, like a high level view of what the goal was with this?
Yeah, so for housing providers, we're seeing, and especially with the silver tsunami, like it's here. Like I think we need to quit saying it's coming, but like it's here. We're seeing a lot of people aging in place in housing because we do have permanent housing solutions in place for them. So they're aging in place, and quite a few folks are getting to the point that they need a higher level of care. And it is very hard to tap into Altex and get people the level of care that they need. In our initial meeting, we kind of all shared stories that we have all had people literally on their deathbed get denied Altex. So we'd really like to be able to tap into that system to say, what are the qualifications for Altex? How can you help us prepare or word an application correctly so that it gets expedited? Could we model something like the SOAR model where, you know, with SOAR, you have a dedicated representative at the Social Security Administration could we replicate that into the Alltech system and have a dedicated representative who knows the population we're working with? I think some of the problems with this too is that our population ages a lot faster than the general population. So you're seeing younger applicants for Alltech's care. But I mean, it's like, you know, we're having to do, these are probably like high cost, high utilizers of emergency services and hospital services. They are people that sometimes, I mean, you have to call it APS because they're in such high need that, you know, we can't provide that level of care. So our whole hope was to be able to work together to bust through some walls, make some connections, to set up a system that we could all use to access whatever level of care that people need in-home support, all the way up to, you know, needing to go into a SNF long-term.
Stephanie, I don't know if this would work, but have we reached out to places like Jackson White who specialize in helping families or clients who have families with getting their family member on Alltech's? Because I know Jackson White specifically has elder law social workers who will help. Now, obviously, they're doing it for a business, but they may have somebody who could reach out to us to at least provide some kind of guidance for how we walk a client through that.
All right, thanks, Laura.
Hey,
You're
Stephanie,
welcome.
this is Michelle. I would like to revisit her. And we work with AUS vets with homeless veterans, and this remains one of our biggest obstacles or challenges as far as with our seniors. And a lot of times they don't have family, even getting them evaluated, getting them assessed. And so when we're looking at addressing the homelessness and ending that, for us, it's so difficult and to find the resources, especially if they're on getting them to assisted living or the financial, and then a lot of times it's hard to get them assessed if they don't want to. We're having a difficult time with this gentleman with advanced Alzheimer's right now, but he hasn't been assessed. He's refusing to, and it's just, for us, this is one of our biggest challenges with our senior veterans, and it's so sad for me we try as much as we can, but I feel like there's always a roadblock.
Yeah, we see very similar things at NAC too. Go ahead, Shayla.
This is Shayla Schuster from Community Solutions, and I want to couch this by saying I don't recommend that we're taking legal action or anything like that, but I wonder if there's someone at Community Legal Services that could help with the criteria and qualifications, kind of like they do with disability, and see if there's a way to like help identify how people are eligible for support. Again, I'm not suggesting legal action, just like legally how people qualify, and maybe there's someone there that could help with that.
All right, thanks, Shayla, for that job. Your hair looks lovely, by the way.
All right. So this agenda is not an agenda for action, so we will, unless anybody has anything else to say, we'll move to the next agenda item.
Sorry, that's me again. Do committee members have any action or discussion items for our September agenda?
I would like to maybe make a suggestion that we have somebody from the Phoenix PD or the crisis. We had a lot of conversations earlier on that. So maybe we could have somebody just come, and I don't know who that would be, but present on how the city is working with the homeless and the resources that they have, or just to have that dialogue. It seems like there's a lot of conversation earlier regarding that.
Anyone else have anything? I'm sure by September we'll have updates on the NOFA process as well, if that's happening or how that's happening. I'm not hearing anything else.
Thank you. One of the hard things when you're doing virtual meetings and when you don't hear feedback, you're like, well, I hope that everybody is in agreement and is really enjoying this meeting. So I just like to assume that everybody is. But anyway, with that, I think that we just need a motion to adjourn. Do I have a motion?
Motion to adjourn.
Hi, this is.
I second that.
Okay, who second?
Daniel Davis from UMOM.
Daniel, and then Joanne first. Okay, thank you. So I'll proceed with a roll call. Adrian Clark.
Aye.
Stephanie Crum.
Hi.
Kathy Denolfe.
Hi.
Trisha Gibson.
Hi.
Wendy Johnson. Wendy? She might have jumped off. Anne Marie Johnston?
Aye.
Laura Magruder?
Aye.
Jennifer Page?
Aye.
Aaron Rain?
Aye.
Nikki Ramirez?
Aye.
Ty Rosensteel?
He had to jump off.
Oh, he said that. Okay, sorry. Thank you. Chayla Schuster?
Aye.
Laura Skutnicki?
Aye.
Steven Stivers?
Aye.
Joanne Thornton?
Aye.
And Craig Tripkin. He might have jumped off as well. We still have quorum, and so the motion passes, and everybody have a good day. Thank you.
Thanks, everyone. Bye.
Thanks, everyone.
Thank you. Bye-bye.